Irritable bowel syndrome. What is it? It's a functional disorder of GIT wherein you'll find abdominal pain, altered bowel habit, and there is no detectable cause such as structural, infective, and biochemical abnormality. Causes: IBSD. Basically, it is diarrhea. The diarrhea is caused due to increased colonic contraction waves, rapid jejunal contraction waves, rapid intestinal transit. And we have IBSC, a constipation is the main feature. There is decreased number of colonic contraction wave. There is decreased orocecal transit. Other than that, we have visceral hypersensitivity with increased response to visceral stimuli. The central neural deregulation, that is symptoms increases on emotion and stress. And apart from it, we have psychiatric features like anxiety, tension, depression, accessory, and we have increased bacterial growth in small intestine, wherein we have altered intestinal flora. The last thing, abnormal serotonin pathway. Next, clinical features. To begin with, lower abdominal pain, and the pain increases on emotion and stress, and relief of pain on defecation. To be specific, in alter bowel, there will be alter bowel habits such as in IBSC we have constipation, IBSD diarrhea, IBS mixed, and IBSU which is unclassified. Diarrhea will be frequent, painless, low stool. There will be gas and flatulence. Because of it, there will be abdominal distension, increased belching. Uh, Belching is nothing but noisy expel of wind from stomach through mouth, and the flatulence means too much gas in the stomach or intestine. Stool, it will be of narrow caliber, hard, and extra intestinal features includes headache, fatigue, and backache. Physical examination, upon physical examination, we find abdominal tenderness and palpable sigmoid. And let's look at the management of IBS. To begin with, in general, we have to give reassurance. We have to avoid alcohol, caffeine. We have to modify diet, that is no for. We have to stop giving fermentable carbohydrates, and we have to stop giving gas-producing food such as bean, carrot, onion, banana, apricot, sprout, wheat, raisin. There will be guidance for regular physical exercise. And to be more specific, apart from reassurance and diet modification, if symptoms resolve, it's fine. We have to continue with the same. But if it doesn't, if symptoms persist, we have to classify it as whether it's IBS C or IBS D type, or if it's simple abdominal pain or bloating. For abdominal pain, we'll give SSRI, a tricyclic antidepressant, 5-HT agonist, and for bloating, we give anti-flatulant 5-HT agonist. So, if we look further for IBS-C, for that is constipation, we have to give stool bulking agent, bran, hydrophilic colloid, which will help in easy passing of stool. And even if it doesn't work with that, we have to give bulk laxative such as isobagal, osmotic laxative such as lactulose, 5-HT4 antagonist, prokinetic. If it's IBS type D, we have to stop giving legumes. We have to uh, stop giving high fiber diets. If it persists, we have to give it antidiarrheal, coparamide, cholecystramine, and 5-HT antagonist. Now, if a scenario comes wherein the symptoms persist even after all of this, we have to give antidepressant amitriptyline. Therefore, to summarize, IBS, irritable bowel syndrome, it's nothing but a functional disorder with abdominal pain and altered bowel habit with no detectable cause. So there will be increased colonic contraction waves in IBS diarrhea type, in IBS constipation type, there will be decreased number of colonic contraction wave. And the main thing to notice here is the psychiatric features, that is anxiety, tension, depression, excess worry. The clinical feature mainly includes abdominal distension, which will be accompanied by pain. The main thing to remember is it increases upon emotion and stress, and the management as shown in the flowchart given.